We typically recommend penile implant surgery for men who have failed more conservative therapies. More conservative therapies can include oral medications such as Viagra and Cialis, or other third-line option treatments such as penile injections, penile suppositories, or vacuum erectile devices. Also, penile implant can be considered in any man who wants a permanent solution to his erectile dysfunction. First thing, once you roll into the operating room, the anesthesiologist will put you to sleep using IV medications and gases. A breathing tube or a tube in the mouth will be inserted to secure your airway during the procedure. Following that, we perform a surgical clipping where we remove the hair from the belly button to the upper part of the thigh. After the hair is removed, we perform a 2-location penile block, one in the area behind the scrotum and one just above the penis, to help with postoperative pain. Following that, the skin is prepared using a 10-minute scrub. So you are scrubbed for 8 minutes with a special antibacterial soap, followed by a coating with a topical soap that is an alcohol soap combination that sticks to the skin, which sometimes gives an orange appearance. While this is happening, the surgeon and the assistant are in the hallway, and we scrub our hands for 10 minutes prior to the procedure to do as much as we can to minimize the risk of infection. Next, the drapes are applied and a small incision is made inside the scrotum. A quick dissection is done down to expose the penile shaft. 2 small incisions are made in the penile shaft. The penis is measured from its root in the pelvic bone out to the tip of the penis, and a custom implant is then opened up for insertion. Next, we place a fluid reservoir in the groin through that same small scrotal incision, and the implant and the control pump are installed and the reservoir connected. Once this part is completed, we check and make sure there are no bleeding areas, and a small drain is placed and the scrotum is closed using 2 layers of suture that are dissolvable, followed by skin glue to keep bacteria out. Once the surgery portion is completed, a special compressive dressing is applied, and the anesthesiologist will wake you up and transfer you to the recovery room. You'll be there typically about an hour, and then you'll go upstairs to the med-surg floor. Most of our patients stay 1 night in the hospital and go home the next morning, usually by 10 a.m. In certain cases, if you and I discuss it, we can create a plan to go home the same day, but it would require a visit to the office early the following morning. Happy to discuss it either way, but again, my preference and most of my patients prefer to stay 1 short night in the hospital. Well, most patients don't need any clearance at all. But if you have any type of heart history, you've had stents, you've had open heart surgery, you've had a valve, or you're on blood thinners, then we may want to have your cardiologist or your primary care doctor sign off on the procedure, make sure you're in as good a shape as you can be for the surgery, as well as make sure we take all the precautions to protect your heart and lungs in the postoperative period. Most men will require a ride when they leave the hospital either the same day or the next day following the procedure. If for some reason you don't have a ride and you want to drive yourself home, we certainly have a number of men who don't require any postoperative pain medicine and elect to drive themselves home. It's the minority, but it can be done in an extreme circumstance. You don't have a family member or close friend that you would feel comfortable taking you home from the procedure. Typically before the procedure, we will have the patient do a pre-op appointment at the hospital. The hospital will call you and evaluate you over the phone, ask you about your medical conditions, and then order a set of labs and preoperative tests. Usually within about a week before the procedure, they'll have you come in and do the testing. They will give you an antibiotic wash soap to use the night before the procedure. If for whatever reason they forget or you forget the antibiotic wash soap, you can go to any pharmacy and pick up a small bottle of Hex or another medical grade antibiotic soap and use that to wash the belly button down to the mid-thigh area, genital area the night before surgery. Once you complete your preoperative appointment, I will see you on the day of the procedure. Well, certainly this always depends on the individual and the individual's risk, but some general guidelines for medications prior to surgery. Any medication that is a beta blocker, which is a blood pressure medication that ends in OLOL, metoprolol, labetalol, are advised to continue during the day of surgery. Blood pressure medications that are ACE inhibitors or angiotensin receptor blockers, those are meds that end in pril or artin, such as losartan, lisinopril, enalapril, are recommended not to take the day of surgery because it can make your blood pressure a little more volatile. So beta blockers or meds that end in OLOL should be taken the day of surgery. ACE inhibitors or ARBs that end in artin or pril should typically be held the day of surgery. Please do not hesitate to call if you have any questions. And then blood thinners are decided on an individual patient basis. Baby aspirin, we never stop. We recommend everybody continue their baby aspirin during the perioperative period. If you're on a stronger anticoagulant, such as Plavix, aspirin, Eliquis, or Xarelto, we need to have an individualized conversation and sometimes in cooperation with your cardiologist to decide whether that medication should be continued or held during surgery. Certainly we can do penile implant surgery on full dose anticoagulation. We just all need to understand the bleeding risk would be slightly higher. Typically, it's recommended no eating or drinking 8 hours prior to the procedure. And this is kind of the golden rule. Some anesthesiologists will allow clear liquids up to 2 hours before the procedure, but this needs to be discussed on an individualized basis. Common rule is nothing to eat or drink 8 hours prior to the surgery. Well, it's important to bring any toiletries that you desire. Certainly the hospital will provide toothbrush, toothpaste, but if there's anything that you want personally, I would recommend you bring that. The next day following surgery, we're going to take the wrap down and you want to have some type of compressive underwear. And that usually includes a jock strap, which are available at any sporting goods stores and many Walmarts. We would also recommend you bring a change of clothes and loose fitting clothing, as well as a cell phone or tablet charger for your phone so you can communicate with your family. We do not recommend patients shave themselves the night before surgery. The reason why is shaving can create small nicks in the skin that can harbor bacteria that can be difficult to remove with the preoperative scrub the next day. So once the patient is in the operating room, we do the clipping and the shaving. You don't have to do anything the night before. First thing, we usually start penile implants first thing in the morning. So most penile implant patients will have to report at 5:30 in the morning to OU Medical Center at Edmond, or the hospital that you're having the procedure done. From 5:30 to 7:30, a nurse will help get you ready for surgery, including starting IV, putting you in a surgical gown, and getting your antibiotics prepared. Once this is done, you'll meet the anesthesiologist and the OR circulating nurse, and then you and I will talk and I'll answer any last-minute questions and make sure all the paperwork is squared away. Once you've met everybody and it's time to get started with surgery, they'll roll you from the pre-op holding area into the surgery room. Next, you'll be induced under anesthesia, and then we'll perform the procedure. Once the procedure is completed and the dressings are put on, you will go to the recovery room, and the typical stay in the recovery room is about an hour. If everything looks good, vital signs look good, pain's controlled, they will send you up to the medical surge floor, which at OU Edmond is either the 3rd or the 4th floor. Once on the third or fourth floor, the nurse will provide ice packs and introductions. You can relax and take a break, call your family, and we generally like you to walk one time in the evening, and you'll be provided a regular diet. The following morning, the catheter will be removed, the penile implant will be deflated, and a key thing you want to do, typically we deflate the implant between 6 and 7 in the morning. So I typically recommend most patients take a pain medicine or take a pain injection about 5 a.m. To minimize the discomfort. Once the device is deflated, the drain is removed. Once you void or go to the bathroom, we typically let you go home. Some men are naturally nervous following any upcoming procedure. One thing we recommend for men who are nervous is to contact our patient advocate, Bob, and ask him what his experience is like so you feel fully prepared on what to expect. Certainly, if you're nervous and you have questions before the procedure, please don't hesitate to call our office, and I'll get back with you as soon as I can. We'll go over all your questions, make sure all of them have been answered, and help alleviate any stress with the upcoming procedure. Once, right before the procedure starts, of course, the anesthesiologist will give you some medicine to help you relax. If you have any questions, please don't hesitate to call. That's what we're here for. Some men and their partners may have questions before surgery. So who should I call if I have questions? I would recommend you call my office. The phone number is 405-340-1279 and ask to speak with me or my nurse. If my nurse can answer the question, great. If not, they'll pass along a message to me and I'll be able to call you back typically within 24 hours.